We are pleased to welcome to the stage Paul Knopp and Ashraf W. Shehata of KPMG LLP.
Well, good afternoon, everybody. We are so pleased to be here at the Kennedy Forum. My name is Paul Knopp. I am the chair and CEO of KPMG in the United States. And with me today is Ash. Let Ash introduce himself.
Yeah, thank you, Paul. And it's a pleasure. I'm Ash Shehata. I'm our National Sector Leader for Healthcare and Life Sciences.
So we're here today for, I'd say, three reasons. One is that KPMG is an organization composed of people. We have 35,000 people in the United States of America, and those people are subject to a lot of the things that we've heard today. So we've all lived the last 3.5 years through a global pandemic. We've lived through an enduring, persistent social justice crisis that continues today. Our people are affected by those things. They are affected by tremendous economic uncertainty, by geopolitical events, and we know that their mental health should always be top of mind for us. We're also here because we think constantly about how we can have impact. And if there's any word as the leader of KPMG that bounces through my head more than any other, believe it or not, it's not profit, it's impact. We are trying to ensure that we impact our people, our clients, and our communities in a really positive way. And that's what we're doing with the tool that Ash is going to talk about in just a few minutes. And then we're here because of our technology, our capabilities, our people that really are bringing to life what Ash is going to be speaking with you about this afternoon. So in terms of that impact, we also think about where we can drive broader results in society, and we're really proud of the work we've been doing the last 3+ years on health equity. We started a conversation with Dr. Valerie Montgomery Rice at the Morehouse School of Medicine about 2.5 years ago about how we could help the Morehouse School of Medicine with their efforts around health equity. But health equity is an issue that is prevalent throughout society in the United States, and we know that we need to have more of an impact and bring more ideas to the front, and quite candidly, more common sense. Because today, as I listen to all the speakers, one of the things that occurred to me is that, like a lot of things in the United States of America, we kind of lack common sense when it comes to the right kind of solutions that we need to bring to bear for mental health. And it certainly has affected my own family, and I won't talk for privacy reasons about who and why and how, but I know by personal experience that mental health is debilitating and it's mysterious, and that we need better access and better care for many, including those in our families. And we know that our 35,000 people at KPMG absolutely need more access. And before I turn it to Ash, I just want to say one more thing about that, and that is that we try to drive progress through our leadership in our vision at KPMG2 with our 35,000 people. An example of that is that our provider for mental health care employee assistance programs tells us that our utilization of those programs is about double of most of our counterparts. And we do that through raising awareness of mental health, and we do it through normalizing conversations about mental health within our own organization. That includes having a business resource group we call Abilities in Motion. Not disabilities in motion, but abilities in motion. And we're trying to drive much better awareness of the issues that we all face when it comes to mental health and substance abuse. And with that, Ash, I would like to turn to you to talk about the particular tool that we developed that we're so proud to have developed and working directly with the Kennedy Forum to ensure that we have impact.
Oh, thank you, Paul. And you can see I couldn't have picked the best person in the firm, our chairman and CEO, to join me today. So he is passionate about it, and you're going to see this across, I think, everybody you touch at KPMG, and thank you for the great opportunity. I did want to kind of start off with the next slide, which is really giving you all a chance to kind of engage in the dialogue a little bit. And I think what's interesting about it is, I think they're going to bring up a slide here to give you all a chance to vote a little bit, but maybe we'll do it at the end if it comes up. But I do want to just start off with, here it is. So, in lieu of the break, I'd like to get you all a chance to engage a little bit. We're going to talk about data. So you all know the routine. I see all the phones going up. Go up there. It's going to open up a question for you. And what I'm really trying to get at here is if you wanted to make an impact on data, what would it be? All right? And you're going to see it there in a very kind of simple manner. And hopefully you're going to be able to take a moment, reflect on it. You get to choose one topic. And hopefully when I talk about the data, I'll be able to cover some of those topics. And I think with the magic of technology, after you all vote, we'll be able to see the data here, right now. So if you look at it, there's a lot of ways to look at data, especially in this very, very precious topic. But it really, if you look at where people are asking us to bring more data to the forefront, this is exactly reflective of the data that we're going to be talking about today. But a lot of people are saying, help me find the providers. I mean, I love that one, because that's saying, it's a very crucial element of our solution. So I think anything we talk about has to be able to be provider-centric. The other thing that I really like to see here is it's equal in terms of community and information. And this is one of the very few aspects of healthcare where the community is a part of the solution. So I think that's going to be equally important. And I love the fact that information is there. Paul, you reminded us about investments in AI. Imagine a future where this data and information is near real time. Okay, so great job for those of you who participated here. Now I'm going to talk a little bit about the solution and show you a few slides. So the first part of it is, when we looked at the data, what we were trying to do is be very purposeful. Number one is we wanted to bring data together to help address the personal issues that people are struggling with. And we've heard so many of those stories, and many of them are personal. My background is I'm a former hospital administrator. And I actually had an emergency department that was focused on mental health illness. We actually had to close it because we couldn't run the operation, and we had to turn it over to the county. I also was a former health insurance executive, where we struggled with building the right benefits for our employees and all of our relationships in the corporate world. So this is something, when I came to KPMG, it's been on my mind, it's been part of my career, and now we have great data to show that. The second issue is, when we start to look at how we can make a difference in the working environment, giving those tools potentially to every citizen in the United States. And then thirdly, being able to pull together data to help us design new care delivery systems. So, this tool was actually built upon something we did during the pandemic. It was part of that COVID resiliency network. We actually also used it to help identify communities in need that needed the monoclonal antibody therapies. So that same data set was sitting there. And when we came together with the Kennedy Forum, we basically unleashed the same data set. We added to it additional claims information and community smart city data, and we were able to create very quickly a highly resilient, real-time mental health national framework. So you can go into this data. This is an example of New York. You can pull in the zip code. You can get the access to the resources, the gaps of care, and it'll help you pinpoint resources and fundamental capabilities you want to bring to that community. On the next slide, and there's a lot of different slides here, so I know you're going to get access to this. Play around with it. Look at your communities. And in this example, you can look at communities outside of your own zip code. How are you doing with your neighboring community? Is somebody down the road doing a better job in your state, in another market? What is happening there, and how do I bring change? So with that, I just wanted to kind of summarize. This is so exciting now. This is something that is not just built in the back room. It's not built on spreadsheets. It's live. It gets updated every day. And the more data we put in it, the faster it learns. So one of these days when we bring the full EHR record around mental health, we're going to add it to this. We're going to enhance our claims data. We're going to enhance our payment data. And I love the way you started, Patrick, when you kind of, in these hallowed walls, there's two missions here. One mission is to inspire, and the other mission is to act. I hope this data will all help you act as we make a difference here. So Paul, back to you.
Thanks. Well, thank you, everybody. And Patrick, I think you said action is where rubber meets the road, and you cannot have equity without action. And so we absolutely will continue to work with the Kennedy Forum to drive more progress and to lead to better outcomes for people in society. Thank you, everybody.
Thank you all.
Are they not the best?